So thank you all for joining us for the final lunchtime webinar of this academic year. We started these webinars last September in the hopes of giving alumni and friends ongoing access to some of the research and thinking going on here at the school. And I'm really happy to say that we've had a phenomenal response. These webinars are designed to be part lecture, part discussion. So we will allow time for questions, either as they come up during the lecture or afterward in the question and answer part of the webinar. If you do have a question, simply type it in the text box in the middle of the left-hand portion of your screen. Also, please feel free to give us feedback using the emoticons. We are going to close out the calendar with a lecture about efforts to improve access to healthy food in so-called food deserts. Environmental interventions aimed at improving the diet of these communities are gaining momentum. We're seeing more farmers markets and corner store conversions, more food co-ops and fruit and vegetable stands. The question remains, though, is it working? Here to address that is Dr. Michael Prelip. He is an associate professor in the Department of Community Health Sciences at the school, and he supervises the field studies component of the Masters of Public Health degree. Mike?
Thank you so much, Carla. I'm really thankful that all of you have decided to join me. I'm always a little concerned about getting in the way of people's lunchtime, so I'm going to imagine that you all have huge plates of food filled with lots of vegetables, and you're all excited about the fruit you're going to have for dessert. I really hope that this is an opportunity to have a dialogue about environmental interventions such as those that we seem to be very excited about, such as farmers markets and corner store conversions, etc. I do want to spend some time talking about some of the things we've been thinking about on some of our recent work here, and just kind of a general discussion about environmental interventions as a whole. So please, if you have any questions, type them in, and I look forward to the dialogue that we're having today. You know, I am so excited that we are really embracing this idea that we need to be doing some environmental interventions, that we really need to be thinking about what is it can we do in the environments, both social and physical environments, of people to help them have healthier lives, make healthier choices, exhibit healthier behaviors. I think in the United States and our culture, we've struggled with being independent and also being part of a community, and we seem to go back and forth between how much is the problem or the issue an individual's responsibility, and how much is it a community's responsibility. And it seems like right now we are really excited about looking at maybe the community needs to take a better look of what can be done in the environment so that people can be healthy. But I'm also concerned that a lot of people are calling things environmental interventions when they're not environmental interventions, where they're kind of the same old stuff. So I just really want to always challenge people who are thinking about doing environmental interventions that they truly are thinking about them, because I think we can reach for the stars right now and really start trying to solve some of these wicked problems. And by that I mean those problems that just seem really, really difficult, including problems such as obesity. Now, there's so much promise with certain environmental interventions, such as changing the built environment to increase physical activity. We know when people have parks nearby their houses, they exercise 38% more than people who do not live near parks. We also know that lower income communities often have fewer resources to support active lifestyles and public places to play. There's a recommendation that there should be about 6 to 10 acres per 1,000 people in a community for recreation. And in a lot of places in California, we only have about 1 to 1.5 acres per person. But there's also great promise with changing the built environment to make roads safer for both pedestrians and drivers. We know that people are more likely to be outside and be active when the streets are safe and there are bike lanes, which, living in Los Angeles, I have never quite understood why we are not a bike-friendly community. I mean, I've been an urban bike rider most of my life, and it's really frustrating. And then something that I'm so excited there's a lot of movement on thinking about joint use projects. When you look around in each community and you see an empty schoolyard at 3:30, you're wondering why can't that be used? But there seems to be some traction right now to actually improve joint use projects, especially in low-income communities. There has been some disparities in funding toward joint use projects where wealthier communities in California seem to be getting more of them. And then we're also very excited about changing the food environment at schools, at the workplace, and in the communities themselves. But I do worry. And why do I worry? I worry about our environmental interventions is if you build it, will they actually come? And two, will they continue to come? My colleague Wendy Slusser, when she was involved in the evaluation of the first salad bar installations in LAUSD schools for elementary schools, they found that during the first 6 months, kids actually took advantage of this environmental change and ate more fruits and vegetables at school. But after 6 months, it returned back to the pre-salad bar level. We're going to come back to this because it's this motivation to actually take advantage of environmental change that is something I think we really need to be concerned about. And then the third question that worries me is how do you sustain environmental change without ongoing external financial support? I think it's a little disturbing and disappointing that so often when environmental changes, such as adding a farmer's market or fruit stands in the neighborhood, that initially they are subsidized by funders to make them financially viable. But when that subsidy goes away, so does the intervention. So I think this issue about thinking about true sustainability from the onset is something we really need to be worrying about. And then my last worry, probably not my last, but the last one I've listed here, is if we do increase access, is that really going to be enough to see long-term sustained behavior change? And that question remains unanswered for a lot of areas. Now, I'm interested in food and physical activity, and as my training is in nutrition and public health, and so food is something I think about a lot. But eating is really, really complicated. And I know you all know that because we all have our own habits around eating. With other behaviors, and all behaviors are complicated, but with eating, it's connected with so many other things. It's not that we can just say to people, stop doing that. People have to eat. We like to eat. I have really fond memories of eating my grandmother's chicken fried steak. And if she was around today and she offered me chicken fried steak and fried okra, I would be interested in having it, and I would eat all of it. Now, I hope you can see this picture well. I just really wanted to explain or demonstrate how complicated food and behavior. We probably could do a similar diagram for any behavior, but taking a social ecological perspective, it's not just I eat what I eat because of what I think or feel or believe or know how to do, but I'm also impacted by my social environment, what my family thinks, what they do, what they feel, my friends and my peers. But I'm also impacted by my physical environment. Which reminds me of a story that I have worked a lot with LA Unified School District, and for many years I evaluated their nutrition education programs. And I remember when they were starting their new programs funded with California Nutrition Network, or Network for a Healthier California funds, that they were really excited and they created a whole lot of new programming. And we were talking about, well, what kind of outcomes do you expect to see because of doing all this new programming? And someone mentioned, well, we want the kids to be eating more fruits and vegetables. It's like, well, we all want that, but it was discussed, what if there are no fruits and vegetables in their communities? Changing their individual knowledge levels and their attitudes and perhaps their values and preferences wouldn't impact their behavior if that food wasn't available in the first place. So what's available in the neighborhood, what's offered at home, in schools, etc. And then there are also some macro-level environmental issues relating to government policies and etc. There. But the point of this slide is it's really, really complicated. Now, I think that, well, I know that when many interventions are created, they tend to function on one level as opposed to being multi-level. And I think that this is one area where, in general, intervention science and implementation science needs to be thinking about how to truly create multi-level interventions so that we're not only trying to improve knowledge and change attitudes and perhaps change behaviors, but we're also changing social, physical, and perhaps some of the macro levels. Now, this is an area where I think people need to also be more authentic in what they are actually doing. Because I see a lot of work out there where people say it's multi-level interventions, but it really is maybe just continues to focus on the individual level. Now, I think about this picture and my social environment and my physical environment, and I think about what it was when I was a kid growing up in the 60s and 70s, and there really have been some changes in food and how we eat. Food just seems to be everywhere. It's readily available, multiple settings. As you all know, we're eating more processed and convenience food. Portion sizes have gotten better, are bigger. There are convenience foods, things like Lunchables, which we never had, and hot flaming Cheetos, which the elementary school kids seem to just love. Parents are working longer hours. People are eating fewer meals together. At schools, even when there are good school lunch programs, there are lots of opportunity for high-calorie, low-nutrient foods in after-school programs. We've changed how food is marketed toward children. So it is a very different world today. So here at UCLA, in the School of Public Health, we've been thinking about a number of projects related to improving food access, especially fruit and vegetable access. And so I kind of think about how I got to this point. Now, I feel really fortunate that I come from a family of farmers, and my mom and her family were immigrant farmers, and I am really thankful because I grew up in a family where fruits and vegetables were not only really common, but it was just, and we ate them without even thinking about them, but we also were expected to grow them. And then I remember my mom taking me out to our kitchen garden when I was probably 5 or 6 years old, and I started working in that garden, and eventually I took it over, and being the nerd that I was, I started creating irrigation systems and cultivating vacant lots in Southern California. And I think about the gift that I got from from my mom and her family related to just the love of fruits and vegetables. And I wish that every kid was getting that today, and it just seems to be not so easy to give that gift anymore. So personally, that's my interest. But also from a professional standpoint, I'm very interested in kind of understanding whether or not improving fruit and vegetable and healthy food access can really make a difference. It seems like it should make a difference. People are excited about it making a difference. But when you actually look into the scientific literature, not a whole lot is known about that. And there are a few studies looking at farmers markets and corner store conversions, but they are limited in a lot of ways, and it really begs the questions about truly what is the effectiveness, among other questions, and I'll talk about that a little more. Oops, sorry about that, getting ahead of myself. Okay, so we decided to start doing some work in East Los Angeles, and for those of you not familiar with East Los Angeles, it's a really old part of Los Angeles. It's just east of downtown, and it is it's been around for a while, as I said, and it's a very vibrant community. It's about 126,000 people. Most are Latino, and most of those are Mexican American. About half of them are immigrants, and it is a fairly young population. Now, one of the things, oops, sorry about that. I will fix that. Okay. One of the other element about East LA that is really exciting for all of us who are doing our work is it's an incredibly vibrant community, and we have the current project I'm going to be talking about in just a minute. We've been working in East LA for about 9 months right now, and we've been overwhelmed with how open-armed the community has been and participated in helping us, and I'll talk a little bit about that. But even though people might view East LA as a low-income community, it has so many incredible assets, and it's just really turning out to be a great place to work in. Okay. You can take a look at this. I'm not going to go into detail, but you can see that it is, again, Latino and about half immigrant populations. Now, we're interested in issues about overweight and obesity. Oops, I keep doing that. I'm doing something wrong. Excuse me for that. I will figure this out. I'm going to go slower and take my hands off the mouse to make that easier. The slide you're looking at right now was created by one of our doctoral students, Brent Langelier, and it just is showing the percentage of the adult population that is either overweight or obese. And you see the darkest are 67% or higher. And if you look at East LA, it's not the darkest color, but it's at 66%. So if it was 1% more, it would be the darkest. But clearly, you can see that there's a problem in not only that part of LA County, but a lot of LA County. We also are interested in the food environment. And if you take a look at these two maps, the one on the left is showing the number of fast food restaurants that are less than a half a mile from a census tract. And again, the darkened areas, the darker they are, you can see that it's more fast food restaurants. And the diagram on the right, it is a similar diagram but with liquor stores, and you can see again some concentration. But I encourage you to contrast that with looking at West LA to the left, which includes the community of Westwood, where I'm sitting right now, Beverly Hills, Bel Air, etc. Okay. Okay. Just a second. I think we're good. Okay. Also, looking at a couple of my slides seem to be missing, but basically one of the slides that's not showing right now is related to the concentration of chain supermarkets that are available throughout the county. And as I'm sure many of you know, there is some disparities between communities, especially low-income communities, as it relates to the number of Ralphs and Albertsons and Vons. And in fact, in East LA, the chains are, it does include like a Food for Less, which is a low, kind of a low-cost version of Ralph's, but also some Latino chain markets, Superior and El Super, but for the most part doesn't include those other supermarkets. One of the things we're kind of looked at, I think we could argue this point is healthy supermarkets. I'm not quite sure what that means actually, but we're kind of viewing that as high-end supermarkets, the Trader Joe's, the Whole Foods, Fresh and Easy. And if you just look at the concentration of those stores in a community, they don't exist at all, and which is really interesting because when we are talking to people out in the community, they often say, we wish they had that. My next slide is just kind of showing some of the differences and contrast between the East LA community and the West LA community. And as you can see, when it comes to hypertension, cholesterol, etc., East LA has a worse profile, and I'm sure that's not surprising to anyone. Okay. Now, we were really fortunate that we decided because of this that we would try to get some money to do some work in the community, and working with my collaborators at UCLA, which you can see the list, under the leadership of Alex Ortega and William McCarthy, we were successful in receiving what's called a P50 Center grant from the National Heart, Lung, Blood Institute, part of their Centers for Public Health and Health Disparities, and we worked with other people from the community and other groups. I'm going to talk about them: Public Matters, Nathan Chang Associates, LA County Department of Health, USC Medical School, and the Urban Institute. And what we're doing in this project is 3 separate research projects. The first, led by Dr. Bill McCarthy, is a project to actually do environmental changes in the home. The idea being that if a home environment is healthier, such as there's better choices in the kitchen, the food is displayed, and we do know that if fruit is there and fruit is sitting out on a counter and it's easy for people to grab and eat, they're more likely to eat it. We also know that if you have a TV in the dining room, it promotes not necessarily good eating or physical activity behavior. So Dr. McCarthy is going to be working with his colleagues at USC to actually redo the home environment of families in which one family member has been diagnosed with diabetes. Our second study is a lab study where Dr. Chris Roberts from the School of Nursing is actually looking at some vascular functioning, really elasticity, and how that relates to immigration status. And then the third project, which is the project which is being led by Dr. Glick, Dr. Ortega, and me, is this Cornerstone Makeover in East Los Angeles. Now, East LA has been characterized as a food desert. Now, I think we've come to the conclusion in the 9 months that we've been out there, well, that may not be exactly right, but this term food desert certainly has picked up a lot of traction. We felt really fortunate that the week that our large grant was being reviewed at the National Institutes of Health was the same week that Michelle Obama used the term for the first time in public. And so the notion of a food desert is a community with poor access to comprehensive grocery stores and foods recommended as a basis for a healthful and balanced diet. Well, I think like many communities that people might be labeling food desert, it's not quite right. In fact, I was trying to think what might be a better term, because there's lots of healthy food options in the East LA community. However, if you look at the photos here, there's a lot of other stuff that seems to be diluting it. And if anyone can come up with a good term for this situation, I'd love to hear it. I was playing around earlier and it came up with not a good one. I'm not very creative with these. It's really more like a healthy food desert island in a sea of not so healthy food. So maybe if someone can tighten that up considerably, let me know, because I think we probably could get some traction on a term like that. So here it's for us, it's not just a matter of the lack of healthy foods, but it's also the overabundance of some really unhealthy choices. Okay. Now, we, as relative outsiders, I mean, I've been working in the East LA community for a while. I've done a lot of work with elementary schools, both focusing on the kids, but also doing some worksite wellness with the teachers, and have learned a lot about them. But we thought it'd be a really good idea to actually talk to the folks in East LA and to hear what they thought about the food options they had. So we did some focus groups, and we're just really starting to analyze this data now. But I think we're already learning some really good things, and it's really helping us understand that. They have told us that what's really helping them as far as making good choices, if there are supermarket specials, if there's a greater variety, especially produce especially for immigrant populations, that are similar to the produce that they from where they come from. And also if they have transportation programs. I'm not sure if in your communities the stores do this, but I believe, and I may be wrong, I think it's Superior, that if you spend $40, they actually will pick you up or take you home, and so they have these transportation programs. This quote from one of the residents: "I go to El Super usually on Wednesdays when the fruits and vegetables are on sale. Tomorrow I'll go to Superior on Cesar Chavez. That bus will take me to Superior on Cesar Chavez, or Food for Less. That's on 8th and Olympic. I usually ride on those quarter buses, and I can go to several stores." So it really is pretty complicated how people choose food, and that they don't run down to the Ralph's like I do, which is a 3-minute car ride or a 5-minute walk for me in my community. The females are more, the food purchasers tend to be the women in the family. They shop at lots of places, but they really are concerned about price, and wherever it's cheaper, as one resident said, I go to several markets trying to find specials. Okay. Another resident commented, a lot of people don't have time to shop for food or don't want to take the time, so they go to the easy McDonald's, drive-thru, Taco Bell, Jack in the Box, whatever is close. As far as what people told us they want to be eating, they like eating at home. They like to economize using more vegetables, less meat, smaller portions. I like hearing all of that. They prefer fresh. They prefer eating at home, but it's really tough to do with everyone working so hard and different schedules. Okay, and most fast food eating usually occurs away from home at lunchtime, and usually with the husbands or the children, or on the weekend. Okay. We've also asked them what do they think about corner stores, because everyone's assuming if you build it, people will come. But corner stores, and we're already learning that people view corner stores very, very different, and there are lots of different types of corner stores. It's not as simple as it's a corner store. One resident commented, they offer a lot, but the quality is very poor. And then the prices are usually higher. You're not going to find anything fresh. You're going to find expired canned items. Maybe in like emergencies, like, oh man, I forgot to get onions, so we'll go over really quick. Something really small, but I never buy full groceries or anything like that. Some of the perceptions people have of corner stores, they're not very clean. You walk around, your feet are sticking. They're not safe. Both from there may be some people around that make the environment not feel that safe, or the food isn't safe because it is not kept at the right temperature. Okay. I'm going to skip ahead a little bit. So what we're trying to do is to do 4 corner store conversions. But even I think something's really important here. Our colleague Rhianna Estrada, who's a visual artist from our partner Public Matters, prefers to refer to it as a market makeover. And the difference being the corner store conversion part is the physical part, maybe adding a refrigerator, buying the fruits and vegetables, stocking them. But the market makeover part is you've got to create that market demand for it. If the communities and the neighbors who live around the corner stores aren't interested in that food, then it doesn't matter what you did in the conversion, because people won't come and it won't be sustainable. And this, I think, takes us back to that diagram, the social ecological model I had of eating, that it's not just about the physical environment, it's not just about the social environment, and it's not just about the individual environment. It's all of that. And so this is really concerning for us as we're just about ready to start our first conversion in the next few weeks, is doing what we need to do to increase further demand. Now, why corner stores? Well, there is some nice research that's showing, okay, they probably can make a difference, but the research is limited, and I've listed a few studies that have shown some positive advantages in results of corner store conversions. So what do we hope to do? Well, one, we want to fill in some gaps and add more to what people already know, is we want to understand more about this process of persuading the store owners to convert their stores, and then also understand what it takes to actually convert them. We are really fortunate in this project to be working with Nathan Chang, who is one of the national experts on this. And what's so great about working with someone like a Nathan Chang has owned corner stores, and he really understands that world much better than someone like I would ever understand it. And he has a system where he really canvasses communities, and he's been working in East LA for the last 6 months identifying stores, and it's a very long process for him to actually identify those stores that are the top candidates, and then it's a challenging process to actually convince the store owners. So one of the things we want to do is really document this and create some tools for other communities so that they understand how to do this in a way that might enable better success as far as the actual conversion of stores. And the second thing we want to accomplish is figuring out what are the best ways that we can actually promote the stores. Now, we're really lucky because we are partnering through our colleagues at Public Matters, Mike Blockstein and Rhianna Estrada, to work with 2 of the local high schools, Torres High School, which is a brand new high school in East LA, and Roosevelt High School. And we're actually working with the kids they're going to become our social marketers. And I really apologize that we didn't have the technology to show videos, but the kids have already created some amazing videos, and they're funny, they're entertaining, and the kids are just going to go wild with doing wonderful things. And right now they're being incredibly creative. But we also want to learn what is it that needs to happen to sustain these efforts. If this is not financially rewarding to the corner store, they're going to go away. And unless we can figure out a way to make this economically viable, then we're dead in the water. And the last thing we want to do is actually figure out what impact this has on the health of the community residents. Most of the literature so far just focuses on people who actually go to the farmers market or who go to the corner stores. We want to actually see what's going on in the community surrounding the corner stores. I think I talked about this, most of it, but we will be working with high school students, community store owners, and we're actually going to be doing a number of surveys, one of the actual community members who may or may not use the corner stores, and then we're also going to be looking at some patrons as well. I'm not going to go into detail about the survey, but we will be actually beginning our baseline survey of the community next month. We're going to be interviewing 1,000 people, and we'll be following them up for a couple years, and we'll go back and talk to those people. And we're going to be talking to people who are the food purchasers and who live around the stores. And hopefully we'll be also doing a patron study looking at the people who are actually in the store. One of the things we're going to be concerned with, did the conversion result in changes in purchasing, but also did it change who's going to the store? One of our lofty ideas here is that these corner stores can not just be a place to buy maybe hot flaming Cheetos and a beer and cigarettes and lotto tickets and then maybe the occasional onion, but it could also be a place where there could be some healthy activities going on. Our first corner store we're really excited about because they have lots of space that they're not using, and some of the things we're talking about with the corner store owners, in addition to improving the inventory, they also have space in back where they're going to do a community garden. It'll be a small one, but they'll be able to grow some fruits and vegetables that they will be able to sell. And there's also, they have a room where they'll be able to do some health education activities as well. You can take a look at this, some of the things we're going to be measuring. But the main thing that we're looking at are people changing what they're buying and how they're preparing it and what they're eating. Okay, so what do I think we're going to learn from this? Well, I have been doing interventions since I was an MPH student at UCLA, and I graduated in 1985, so 26 years, I guess. And this is a really tough intervention, and something I worry about, yet something else I worry about, is to convince store owners to make these huge changes in their livelihoods, because the profit margin in a corner store is not very large. And for many of these store owners, they may have an annual income of $50,000, $60,000. And so to mess around with that is going to be, they're going to be hesitant about this. But so many factors are going on that go into an environmental intervention, and it's going to be really, really tough. And I worry because we have this great opportunity to demonstrate it can make a difference, and so we really want to make sure we can do that. It's going to be very easy to change the physical markets compared to changing the other market, the demand for the fruit and vegetable. With the competition that exists the fast food and the unhealthy food options. Also concerned, I think we're going to learn about what needs to go on related to buzz. Now, with each of these corner store conversions, we're going to do some really high profile, loud announcements that these have occurred. But one of the things, and it goes back to what we've learned with the salad bars at the schools, there has to be ongoing promotion. And without that ongoing promotion, the buzz won't last. And the challenge with ongoing promotion is there's a lot of noise out there, a lot of clutter. People are exhausted with promotion of everything. And so what has to happen to keep that buzz alive? And as I think I said, without improving the business owner's ability to make money, this will all go away. But actually, this is a real incentive for business owners. For many of these corner store owners, they appreciate the opportunity to learn more about inventory control, learn how to deal with purveyors, how to create a business plan. And so this is something we'll be focusing on. We're going to learn a lot, and we're going to get to work with some really great people along the way. Okay, I feel like I've been speaking quickly.
Thanks, Mike. We do have time for questions. If you have a question, just type it in the text box in the middle of the left-hand portion of your screen. While we're waiting for folks' questions, Mike, you talked about resistance from some of the store owners. Did you encounter resistance getting these 4 stores to join you in this survey? And if so, how did you overcome that?
Well, so far we actually have 8 stores involved in the project. 4 that are being converted and 4 that are going to be comparison, so we can see changes over time if we can associate them, or if we can be more likely to associate those changes over time with our conversion. You can imagine the challenge to try to convince a non-converted store, a store we're not going to convert, to participate, because the incentives are very low. Well, the challenge in overcoming this, I think we've identified 160 corner stores in the East LA community. So there's lots of it. And so part of the process to get to the 4, there's been a lot of factors that have been considered. One is the store actually a place that sells food rather than just liquor? But also Nathan Chang and his kind of surveillance work has gotten to know about foot traffic and the type of clientele that go into a store, and he's actually had conversations, many conversations with them before we've even approached them and asked them to be in the project. And so Nathan has learned in 10+ years of doing corner store conversions that you just don't walk in the door and say, hey, we have a bunch of money, we want to convert your store, can you sign on? That he first has to develop a relationship with them. Recently, I think 2 weeks ago, I went to meet the owner of the first corner store we're doing, lovely woman, and they're really excited about the possibility of doing it. And so once the right stores have been selected, Nathan has found to have a really good uptake response. But that's because he does a really good job of kind of vetting them. And this is one of the goals of what we really want to do in this project, is get this all out on paper and in toolkits, and so that communities that aren't fortunate enough to have someone like a Nathan Chang doing this would be more likely to be successful at selecting the right stores, because that would be a problem.
There are a couple of questions here, Mike. Both Nicola and Dan would like to know when you're starting the project and how long it's going to last.
Well, this is, as I mentioned, we're not doing all our corner store conversions at the same time. The first corner store conversion is starting next month, the actual physical transformation. Because of the school schedule for the high school students, we're going to be a little delayed for doing a lot of social marketing. So we're doing what we're calling our hard launch in the fall. We'll really be pushing it. And then we're going to be doing our second store in the fall. And then the third and fourth stores will be done by this time next year. And then, so once a store, we're going to do our baseline data collection before the store is converted, and then 2 years later we'll be doing a post data collection as well.
There's a question from Napa County Public Health. In Napa County, we're lucky to have physical access to healthy foods. The problem may be more related to price for low-income families. Do you know of work being done at the policy level or to develop local food systems to ensure prices don't limit people's fruit and vegetable consumption?
Yeah, what a great question. And I think it goes back to, again, understanding the complexity of eating and that larger policy government issues. I think we're living in a good time where at the federal level, people are really concerned about this, and with Michelle Obama's lead and her Let's Move program and her interest in food deserts, that people are talking about this more. And I'm really happy to see what's gone on related to using food stamps and WIC coupons at farmers markets and all. But I do think that this is an issue that people are talking about, and more needs to be done. I wish I had more answers in that, but I think this notion of local food systems is really interesting, and certainly living in Napa, you guys, I think, should be taking some lead there because you have such great soil there and can create such great food.
We do have time for a few more questions while we wait for people to write in. I'll ask one more. I know that the government, Mike, recently came out with a food desert locator, and you could see that they were just all across the country. What is going on the national level to address the issue?
Well, you know, we were looking at that map the other day, our research team, and it does seem to be. I'm not sure if I completely agree with how they've done it, and I can't remember why I think that, but it just seemed like every place was a food desert, the way they defined it. I think that, again, what's really happening on the federal level is bringing attention to this and this awareness to this issue, and I think that's a really important starting place, because a lot of people, I think, especially in communities that have the resources, aren't fully aware of what a food desert is, or what an environment where there's just a lot of more unhealthy than healthy food options. So I'm really happy to be seeing segments on CNN, on the CBS News, and the President's wife talking about this, because I think it was really helped move people's understanding that it isn't as simple as people making bad choices. People are maybe making less than ideal choices in a context that is really promoting that poor choice.
Dan has a question. He wants to know what actually constitutes a conversion.
Yeah. That's a really good question, Dan, and it really it depends on the store. But for the most part, some of the major issues that have to be addressed, one has to do with refrigeration and having proper storage for fruits and vegetables to make certain codes, which by no means am I an expert on that. And so refrigeration is an issue. Also, for many stores, the conversion involves just making them look better. A lot of these corner stores you go into and they don't look very good. The paint is peeling, the walls are falling down, the cement, many of them are just cement floors. They're really, really unappealing, and so it's just a sprucing up. But then there's the business side of the makeover, changing the inventory, changing the way that a store owner displays and markets different foods. For many of these store owners, they were never really trained to do this. They just do it the way they do it because this is what they think is the best way to do it. But part of what Nathan Chang does in working with the store owners is help them understand how to display things, to promote things. We'll also be working with the store owners to create business plans, and so there's a conversion on that level too.
And Mike, Rachel wants to know if there are incentives being presented for markets to participate. Are you working with produce companies, for example, to give better pricing to the markets?
Yeah, well, there are incentives that the stores will be getting. The conversions I talked about just a minute ago, such refrigeration and painting and stuff, that costs money. We're going to be doing that for the stores. Also, part of the work that will be done with the store owners is to connect them with wholesalers, and so that they will be better equipped to do that. And if possible, and this is one of the things we've talked about, it's not sure if we can do it, with the 4 stores, if they can be working together to get better prices.
And Nicola was talking about the money issue as well. I imagine you're infusing dollars into these corner stores in order to make this happen. How is this sustainable?
Yeah, it's such a good question. And as I talked about in this afternoon, a real concern of ours is this sustainability. We are not the only money we're putting into the stores has to do with changing the physical environment, and we're not giving any money to buy produce or to discount the produce, and I think that that's going to be a really important step to be able to demonstrate that it can be a viable model if the store has the equipment. I think you bring up a really good point. I'm going to think about this a little more for other communities that don't have resources to actually do the physical conversion. That will be a challenge. But again, the sustainability is going to be related to people coming in, buying the stuff, and the store owner making a profit. But again, we're not putting any money in related to discounting produce.
Another question, Mike. Does part of the conversion actually suggest that markets discontinue certain products, or is it focused just to add access to fruits and vegetables?
Yeah, it would be probably nice if we could say stop selling the chips and etc. But you know, this is not the approach we're taking, because the store owners would not agree to that. I mean, this is how that's their bread and butter. And hopefully what we'll be able to do in these conversions is, at the end of the day, there'll be a shift in what is being sold. So it's not, if there is a decrease, and hopefully there'll be a decrease in the number of bags of hot flaming Cheetos, but there'll be an increase in the purchasing of healthier foods. So no, that would be a really, really tough sell.
Like you mentioned, the links to the social marketing campaign that's going on. Is it possible to put links on that people can see? And is there another educational component that's going to be going on, say, in the schools to let people know about, the community know about the conversion?
Yeah, right now we're eventually we can post them. There's some that are just about ready for people to see, but they're in post-production right now. Some of the videos, as I said, the kids have created 4 videos. They're going to be creating a whole lot of other marketing materials as well, and eventually we'll have all of this on the website for the project. Now we're focusing right now the social marketing. Even though the kids in the high schools, and this is part of their regular classes, we've actually integrated into one of their elective classes, they're going to be focusing their social marketing efforts on the adult population. And we made that choice because of a resource issue. We're currently trying to get additional funds to be doing some marketing aimed at the the high school students themselves and targeting the kids in the schools. Our relationships with the two high schools is growing, and it's really strong, and we're really excited about the administration's support there. And I would imagine that we will be doing more and more focusing on the kids, because for the kids at the high schools, this seems to be a really hot topic for them right now, and they are very interested in this from a social justice standpoint, and so I look forward to doing more of that work, and I know that my colleague Dr. Glick and I both are really interested in doing more with the high school kids.
You pretty much answered Nicola's question here. She was talking about the marketing and how you're going to market to the community, ensure that there's demand from the community, saying that there's been problems with similar conversions in Baldwin Park.
Yeah, we're going to be, as I said, we're in the process of designing it. I think with one of the high schools, we challenged the students, or the Mike and Rianne from Public Matters did. They put them in teams to come up with marketing plans, and a couple weeks ago we were out there and they presented it to us, and I got to tell you, I was so impressed, one, with the professionalism of these high school students. They dressed up for us and they had their pitches ready to go, and they have some really great ideas, and it really is about getting in people's face, not necessarily literally, but doing some really fun stuff that's going to be ongoing, because we know that people have got to be hit with a message, 5 to 10 times, a lot of times, and so this is going to be a huge challenge, but that's what makes it a multi-level intervention, to not just be changing the physical environment, but doing the social marketing as well.
Mike, has any thought been given to using food trucks to bring sort of mobile groceries into these food deserts? Do you have any studies been done on that?
I'm not aware of them, but it's an interesting idea, and because in communities like East LA, there are a lot of fruit and vegetable trucks. And we're going to, I think, understand this a little more after we collect our baseline data, because we're going to be asking a lot of questions about where people are actually buying their fruits and vegetables. One of the things that we'll be filling in some of the knowledge gaps has to do with Latino communities, because this is really the first intensive conversion study that's been done in a predominantly Latino community. But I think that's a really interesting idea.
Well, it looks like we are out of questions and out of time. Mike, thank you so much for this great webinar, and thanks to everyone who joined us for continuing the conversation. If you have ideas for future webinars, please do let us know. You can type your suggestions on the screen, or you can email us. If you missed any webinars, just go to the School of Public Health's website. They are all archived there. Have a great summer. We will be back with more lunchtime lectures in the fall. See you then.